iVantage is a web-based business intelligence solution that allows us to do performance benchmarking. They have a very robust data set, and they also have a very rigorous approach to data validation. You get your traditional benchmarking, things like cost per unit, man-hour per unit. You can also take a step back and do a more comprehensive approach from a system. So how does UnityPoint Health benchmark as a system? It'll also allow us to benchmark quality data as well. As outlined in our 2020 roadmap, our desire is to have a sustainable, high-performing organization through efficient and effective operations. iVantage will help us achieve that by looking at opportunities to improve both cost and quality. We will benchmark in all areas of our organization: clinical areas, support areas, business functions, as well as system services. So with iVantage, one of the first things they'll do is figure out what's the best peer group for you. If you think of UnityPoint Health, we have 9 different regions, we have different sized hospitals, we have different sized clinics. So what makes sense? What's an apples to apples comparison for your organization? So that's the first key. The second key is the data validation approach, making sure that, again, it's an apples to apples comparison. Different hospitals handle different functions differently. So they want to make sure that you've got an apples to apples comparison that your managers can feel comfortable with. Now you've got a good set of comparable data, and you can see where you stack up against your peer group. This will ultimately result in better care for our patients. There's been multiple studies, time and time again, that show highly efficient, cost-effective operations deliver better care for their patients. In the history of UnityPoint Health, we've had very limited entries into the benchmarking area. And so while there's some publicly available domain data, this will really be the first time where we've had a really in-depth view at some very specific information that a department manager, for example, can use to compare himself or herself and their department performance against others. By comparing UnityPoint Health to other organizations, we can really see where we have opportunities to improve. One of the things we liked about the iVantage tool set was it's very transparent. So not only do you see what the top performers are doing, you know who it is, and so you can reach out and network with them to find out what they're doing. With the iVantage tool, I think not only will we find areas of opportunity, it'll also help us recognize best performers. There may be areas that are already operating at the top quartile performance, and this certainly will give us an opportunity to recognize those individuals in those departments. So the iVantage toolset really allows us to stay true to our belief that we should be making decisions based on data. Again, this is data that for the most part historically we've not had access to. So again, by getting this robust data set, apples to apples comparisons to your peers, it'll allow us to make good decisions based on the data.